If you could use one word to describe what it's like right now to be in the hospital, what word would you use?
I feel like we're almost like at war. I feel like you're in a war zone.
That was Dr. Lisa Salmon describing what it's like to be in a hospital right now battling COVID-19. Staff are swamped dealing with sick patients.
We're seeing a ton of COVID positive patients, and the ones we're seeing in emergency department are really, really sick. And so what's happening is our hospital beds are full and our ICU beds are full. And when that happens, the trickle effect is that our emergency department is full.
On January 7th, Dr. Salmon tweeted that it was the most difficult day in her 14-year career, seeing 2 patients die of COVID, 20 others admitted, and no beds or resuscitation rooms to spare. It's why she and other health professionals are calling for a more efficient and quicker vaccine rollout.
We've seen that the rollout has been rather slow compared to other countries around the world. We're not getting vaccines into the arms of those who need it most, those who are most vulnerable. And we're not doing it at the speed that is needed to get through this pandemic in an efficient and an effective way.
By the numbers, the province has fully vaccinated nearly 6,000 people and has administered just over 100,000 single doses as of Saturday morning. However, the University Health Network said they would run out of vaccine doses on Friday night. And that is just one of a few hospitals worried about exhausting their vaccine supply soon. Dr. Desani has advice for the government's rollout.
We also can't get bogged down in silos and bureaucracy. And in healthcare, we have a lot of silos and bureaucracy. Now is the time to be innovative and borrow from countries that are doing really well, like Israel, who has treated this pandemic and the vaccine response as an emergency response. There are many people out there for a variety of reasons who've experienced trauma with the healthcare system and have a mistrust of the healthcare system. We're hearing from racialized communities that there is a mistrust of the vaccine. And if we don't address vaccine hesitancy, which is not exactly anti-vax sentiment, but people who are just worried or scared or don't feel that they have enough information, then we won't get uptake. So a public campaign around vaccine hesitancy is also needed now more than ever.
According to a coronavirus vaccine data tracker website, Ontario has 196,125 doses available and has administered about 44.6% of its current supply of vaccines. Moderna and Pfizer shots are expected to arrive in the province this week. For City News, I'm Brandon Rowe.